This is the very first time around.
This has now been the largest influx of patients that we've ever taken care of. They've been the sickest of the patients we've ever taken care of. They've had the highest mortality throughout the pandemic, and it's been by far the hardest time to be doing what we're doing in the last 3 months.
We're now in the throes of a surge, like across the rest of the country, of the unvaccinated. I'm Dr. Ed Marans. I'm the Chief Clinical Officer. The impact of the surge is that we can't do what we normally do. We've restricted and almost eliminated entirely elective procedures because we don't have the beds. The beds are full in critical care and other areas of patients with COVID. You know, the typical surgical admission could take maybe 3 days in the hospital. A very typical COVID admission could be 3 weeks. So patients stay a long time in the hospital. Patients stay so long in the hospital that at some point they stop testing positive for COVID, but still need hospitalization.
People sort of trust that the healthcare system is going to be there whenever they need it for a heart attack or a bleeding problem or an infection of some kind. And the truth is, we are so busy managing the volume of cases of COVID that we simply can't promise that we'll be able to be there for all those other illnesses.
Get vaccinated. It's the only way to go. I wasn't vaccinated, but if and when I'm out of here, I do plan to get vaccinated. So I think that if you have an opportunity as a human being for each other is to take care of each other, to get vaccinated, to protect each other, because life is not guaranteed to none of us.
It provides a physical challenge as well as an emotional toll that it's taken on us. We're really tired. I am fortunate that my mom is an ICU nurse, so I'm able to talk to her and support each other, as well as my husband being an employee here. I also am in therapy.
We're happy to take care of you, but it would be so much better for all of us if everyone was vaccinated and we could focus our attention on the people that really needed the care and did everything they could to prevent this illness. This will only get better when we're vaccinated and we all do the right thing.